Hi, my name is Christina Roden, and I'm a graduate student, nursing student at Benedictine University. My project is promoting rest in the pediatric department through an evidence-based therapeutic environment program. The background where the problem lies is a pediatric unit at Northwestern Medicine Central DuPage Hospital. The pediatric unit is comprised of 22 beds that cares for acutely ill children aged from newborn to 19 years old. The barriers to uninterrupted rest at this hospital is that vital signs are required to be completed every 4 hours, day and night. There are no quiet hours on the unit, and there's lack of noise monitoring at the nurses' station. The PEWS documentation tool is used to identify patients who would be eligible for less frequent vital sign monitoring overnight. It's a patient assessment tool that provides a hands-off assessment that determines a score that identifies pediatric patients that are at risk for physiological deterioration. The importance of this project is that the American Academy of Pediatrics recommends that teenagers sleep 8 to 10 hours per night, while younger children need even more, and we know that hospitalized children are subject to interrupted rest, and so they are not meeting these requirements. Again, relevance of the project. The children admitted to the hospital are vulnerable and are subject to major stressors such as unpleasant medical interventions. They're ill, and it's an unfamiliar environment, so they're scared. And care is focused mostly on interventions and monitoring, with little to no focus on the prioritization of rest. And lack of rest in children can lead to increased stress hormones and poor recovery from an illness. Caregivers of pediatric patients that are not well rested are less able to cope with their child's illness, are less effective in supporting their child, and have a harder time participating in decision making. With increased rest and improved recovery, we can assure that we have greater patient and family satisfaction and quicker patient recovery, so hopefully less long stays in the hospital. If protocols were in place for nurses to have a more hands-off approach, especially at nighttime, and the atmosphere of the nursing units were more conducive to rest, nurses would be more empowered to provide patients with better opportunities to rest while in the hospital. For the literature review, the first theme we looked at was sleep disruptions in the hospitalized patient. Many felt that vital signs, blood draws, just any type of intervention that caused an interruption in rest was the biggest component of sleep disruptions in hospitalized patients. And then also that nurses felt that the noise on the units was really affecting the patient's sleep. One study looked at nursing working with physicians to have less frequent interventions on the night shift, and it did increase sleep for patients. Another thing is that nurses feel that while they can do things like cluster care and do have interventions that help increase rest, limitations are felt due to patient care orders. So that would be a great thing to look at with the physician. Theme number 2 were strategies to minimize sleep disruptions in hospitalized patients. 2 studies looked at MUSE and PEWS. These tools, again, are one's pediatric focused and one is adult population focused, and these tools are used to recognize patients that are at risk for deterioration while using a hands-off approach. So no blood pressure, no temperature, things that are apt to wake children or patients up. And they noted that using these tools, they didn't have any patients that had any complications, and everybody was discharged on time. Another interesting one I thought was one study looked at a sleep menu that was provided to patients, and they felt that the patients felt that although noise was still a factor that disrupted their sleep, they were more satisfied because they felt that the nurses actually cared about their sleep. The project framework that we'll use is family-centered care. It enhances communication between families, patients, and healthcare providers by understanding the needs of the family and the child. By utilizing family-centered care, the promotion of rest in the PEDS unit can be accomplished by identifying environmental adjustments and appropriate monitoring that support the child and the family's rest. This framework will guide the project because it places the focus on the family, much like we do in pediatric nursing, and when the needs of the child and the family are understood, the care team can then work more efficiently together to provide quality care. When looking at the SWOT analysis, we look at the strengths, which would be increased patient sleep leads to more efficient patient recovery, increased patient sleep leads to improved patient satisfaction, and improved patient satisfaction positively affects nurse workflow. Why do I mention this? So, when a patient and family are satisfied with their care in the hospital, it allows for the nursing staff to focus on the care they're delivering as opposed to service recovery of an unhappy patient and family. And so that's really important to think about. Weaknesses would be changes required to current policy and procedures. As far as our vital signs every 4 hours, we would be looking at overnight, maybe stretching those out to every 8. Need for some funding on this, and then need for adjustments to current pediatric unit atmosphere, and we will require buy-in from key stakeholders involved in the decision-making process. The opportunities would be, if successful implementation on the pediatric unit, it could be adopted by other units in the hospital. Contributes to research on improving rest in the hospitalized pediatric patient, and then by improving, again, patient satisfaction, the organization will have improved Press-Ganey scores and be more likely to be sought after for healthcare. The threats, there is a limited amount of research on this topic, especially regarding the pediatric population, and again, it will require buy-in from key stakeholders in the decision-making process. But through the creation of a thorough and structurally sound project focused on improving rest in the pediatric patient, the outcomes of the project can be used for future research. And so by supplementing the current research, the threat is mitigated on that end. And we can overcome requiring buy-in by presenting a thought-out and thorough presentation of the proposed project. The setting, again, would be Northwestern Medicine Central DuPage Hospital's pediatric unit, which is, again, 22 beds, that cares for acutely ill patients, pediatric patients. And the objective is to create a hospital environment that's therapeutic and supportive of rest and the reduction of stress, thus improving patient recovery and patient family satisfaction on the PEDS unit. So the proposed evidence-based change is to implement this program that provides a therapeutic environment that improves the quality and amount of rest patients and families experience. To do this, we would implement a quiet hour on the unit that we would refer to as nap time. During the daytime hours, maybe from 2 to 3 p.m., we would just have no visitors, no procedures, no testing at that point, so that we can allow for a nap time for our patients. Establishing a set time for lights out on the unit at bedtime, so around 10 p.m. we would turn the lights down on the unit and, again, bring the noise level down and create a more therapeutic atmosphere for those patients. We would identify patients that are eligible for the less frequent vital sign monitoring overnight through the use of the PEWS tool. Sorry about that. Whether that be certain patient populations and or patients that have a PEWS score that's in a desired range. And then little things such as just creating a more conducive environment for rest, such as putting noise trackers at the nurse's station, implementing white noise machines into each patient room, and then putting door stoppers on patient room doors so that they don't slam. And then providing education for parents on ways to promote rest for their child while hospitalized by working with Child Life to create a sleep preference sheet or just being able to offer tips on how to increase rest. This is a great fit for the pediatric unit at Northwestern Medicine at Central DuPage Hospital, as there are no current initiatives or protocols to promote rest on this unit. We often have parents and patients complain about disruptions to rest and noise on the unit, so we would anticipate higher patient and family satisfaction scores after the implementation of this project. The key stakeholders would be the clinical director of the unit, the CNS of the unit, the pediatric leadership team, and the quality and practice committee on the unit. Cost of implementation for the program would be low, around $3,000, give or take. Really, the bulk of the project would be building the PEWS tool into the Epic charting system and doing some education for the nurses on that tool, and then also purchasing the white noise machines, the door stoppers, and installing those on the unit. And then the noise trackers at the nurses station. The surveys and the signs for nap time shouldn't be too expensive. When looking at the cost-benefit analysis, though, the cost benefits that the implementation of a program to provide a therapeutic environment that improves the amount and quality of rest for patients and parents, reduces stress, improves patient recovery, and improves patient family satisfaction are that there will be shorter or not as prolonged hospital stays, as well as improved patient satisfaction. By promoting shorter hospital stays, the facility and the patient will both save money and resources. When patient satisfaction is improved, the healthcare organization accumulates a bigger patient population, therefore increasing revenue. The outcome measures that we are looking at are to improve the amount and quality of sleep and rest for the pediatric patient, to promote patient recovery and healing, to reduce family stress and fatigue, and to improve patient and family experience by providing a therapeutic environment for rest and relaxation. The data collection that we will use is a combination of paper and web-based surveys to evaluate different outcome measurements. So prior to discharge, we would plan on giving a paper survey to the patient or family to determine the amount and quality of sleep per night that occurred. And then after discharge, a web-based survey provided by Press Ganey will be emailed to the patient or guardian, which will include questions regarding the environment and how conducive it was to rest. When looking at measurements of outcomes, again, we're going to use the Press Ganey surveys. Press Ganey uses a patient-reported outcome measure, which are statistically valid patient measures that assist healthcare providers to understand long-term patient care results. This tool is a great fit for this program because understanding the patient and family's subjective perspective is the most accurate way to identify success. After presenting this proposed program to the key stakeholders, I got nothing but positive responses. Everybody seemed very positive, and I'm excited about this because this is a very low on their radar kind of topic. We don't have any policies that encourage anything like that, so they were very excited. And I think the only foreseen barrier that we thought of was changing in the nursing culture of having a more hands-off approach at nighttime, because as nurses we want to be in there and we want to be assessing, and so it might take a little while for staff to get used to this. Moving forward with the project, we will just present to the Pediatric Quality and Practice Committee and then present this timeline that's shown here for implementation after receiving approval. Reflection. So yeah, I've really enjoyed creating an evidence-based project. This is very new to me. It's challenged me. It's taught me a lot. I feel like I definitely am more of a scholarly nurse now, and I feel that I can kind of give my expertise to now my coworkers. And I feel like the hard work that I've done on this project is really, it paid off for me, but mostly in the sense that the pediatric patients on the unit are going to be benefiting from this. Because they're going to get more rest, they're going to get more sleep on the unit, and the families are going to be happier, and the patients are going to be happier about this. My little takeaway is just a quote by Maya Angelou that I thought was pretty fitting, and it's, as a nurse, we have the opportunity to heal the heart, mind, soul, and body of our patients, their families, and ourselves. They may forget your name, but they will never forget how you made them feel. And I feel like through this project, I'm putting a big emphasis on caring and caring about their rest, which is a huge thing, and I think is often overlooked. And so I thought that this quote was very fitting. So These are my references, and thank you very much.